Hello, everyone, and welcome to this audio podcast. This audio podcast, in regard to a research presentation overview, and I look at this audio podcast as part of a ZtormLabostix production. Uh, in this audio podcast, in this sort of audio podcast, looking at an overview and sort of an adaptive perspective of published works, of peer reviewed and published works, and works in regard to supporting patients through social media, and this works this sort of the where the original works from was published in around 2014. And so as part of this audio podcast, sort of going through sort of parts of the publication in a form of a in a form of an audio podcast, sort of meets a sort of presentation, a sort of presentation sort of perspective. So this audio podcast, or as part of this audio podcast, there will be a link to the actual reference and citation of the original works. Should anyone want to check out the published works, and the original publication from 2014 doesn't did not factor in, or did not include or have perspective on in regard to KDARS, the Kidney Disease and Renal Support Group, KDARS group for kids, since KDARS was sort of conceptualized and founded or co-founded in sort of in a later time. So this sort of presentation looks at the publication, but again, sort of an adaptive perspective. So a little bit in regard to the contents of this ZtormLabostix presentation. So a bit of introduction, a bit of some aspects in regard to the mechanistics, some aspects and works in regard to the works of the RPSG and KDARS, bases in regard to social media and healthcare services, looking at also looking at sort of where part of this presentation there will be a sort of a link to the website in regard to RPSG and KDARS, and where listeners listeners and viewers can find out more around the RPSG and KDARS projects, and looking at an overview in regard to implications for practice, and looking at a discussion, and then some conclusion. So to begin with, CKD complications, CKD or chronic kidney disease complications stems from complex and primary comorbidities, at least in the adult population, ultimately becoming multi-systemic. In pediatrics and young people, CKD etiology can originate for several reasons. For example, from congenital, hereditary to endocrine, endocrine and physiological devastations. So, owing to the nature of the disease, CKD patients also encounter various healthcare services that stem from laboratory investigations. CKD patients can also be on various pharmacotherapies throughout the disease pathway. So, by providing healthcare services through education, this would prompt empowerment to thus reduce difficulties of inequity surrounding healthcare, and improve population health. At the same time, there is a correlation between challenges of CKD and health-related quality of life. Health-related quality of life being abbreviated in amongst literature as HRQL, and this also works. This is also works to inform that associations between between a decline in HRQL or health-related quality of life and increases in morbidity also prompt associations between increases where there's increases where there is increases in morbidity can be associated with more hospitalization and challenges in regard to the adherence with and amongst pharmacotherapies. So this overview looks at the RPSG and KDAR's initiatives, where patients and carers had co-developed online social media platforms for people with CKD. This presentation also sort of outlines how patients and professionals can advance clinical practice and research through involvement with integrity. So some mechanics. I look at some mechanistics. So where patients would normally see more than one health professional, identifying and having access to peers to help inform shared decision making is advantageous. Further, to schedule online consultations with either patients and professionals who have understanding is becoming more important, owing to how, for example, mainstream social media is utilized. The kidney disease and renal support group, or KDAR's group for kids, which has been working through social media to improve CKD awareness since 2014, and the renal patient support group, the RPSG, since 2009, and where amongst literature and amongst the sort of general evidence amongst published works, for example, empowered patients are more probable to make informed decisions surrounding healthcare choices, and education is also an important mechanism. So sort of an overview in regard to the work of the RPSG before going into some of the social media platforms that the two organizations have been utilizing over the years. So, the RPSG and the KDAR's group for kids are originally social media or Facebook groups, and the RPSG was co-founded in 2009, and KDAR's was sequentially co-founded in 2014. The focus of the RPSG and KDAR had been to see that there is space for patients and carers between pediatric and young people and adult online renal populations following routine kidney care clinical appointments. The co-founders were aware of difficulties healthcare service users were having following sort of face-to-face appointments, for example, time limitations with clinicians and recalling important questions, etc. So the co-founders then investigated several online platforms, including Facebook, and it was selected because it was accessible, user-friendly, and allowed healthcare service users to share experiences with international reach. And although both platforms now have expanded across social media platforms, the humble beginnings of platforms had various sections. So now looking at sort of social media and healthcare services. So for several years, healthcare professionals have looked to develop or integrate service provision whilst also knowing that there is a need to be responsive to opportunities for change, including through use of social media environments, for example, for example, social media organizations, social media groups, or social media platforms, etc., can be used as safe spaces for people with health conditions. The online spaces allow a sense of connectivity, allowing sharing of challenges and experiences, encouraging patients and professionals and researchers to work together and better care. There have been several publications also to inform the use of social media in healthcare, including works by Murray and team from the early 2000s, around 2004, Farmer and team in around 2009, and Green and team in around 2011. So now looking at the sort of main social media platforms that the RPSG has specifically been using across. So, for example, one primarily again Facebook, where there's one social media Facebook group, and where the Facebook group has in around 10,000 healthcare service users, carers, etc. From the adult kidney or renal population since 2009. Additionally, there is a ResearchGate page which has 350 plus research items or publications surrounding science, nephrology, and healthcare research since 2009. There's an Instagram page, an RPSG Instagram page, which has around over 1,400 image posts and over 70 video posts surrounding science, nephrology, and healthcare research since 2012. There is also a WhatsApp group referred to as CKD et al., which is a WhatsApp group that was initiated to unify ideas and seeking ways to co-develop projects, patient involvement in research, and streamline partnership working between patient and professionals since 2020. And then in regard to CADAR social media, sort of specifically, there's one Facebook group, which has over 2,000 healthcare service users where the healthcare service users, patients and carers, etc., around the pediatric and young renal population since 2014. A ResearchGate page which has 60 plus presentations since in around 2014. One Instagram page which has been recently founded in around 2023, CADARs for kids, but additionally, in additionally to inform that the RPSG, the original RPSG Instagram page, for example, is an Instagram page that is in collaboration with CADARs, which in a collaboration with CADARs, the CADARs organization as well, and sort of more recently, CADARs. CADAR social media also includes one TikTok platform, page or social media page where there is a sharing sort of aspects in our healthcare regarding pediatrics and young people, and again where the KDAR social media for TikTok had been recently founded in 2024. And now, where there's sort of where social media has been utilized in collaboration between RPSG and KDARS more specifically includes Twitter, where there's over 3,000 tweets representing nephrology and healthcare research since 2018. There's a blogspot or blogger which has over 250 journal posts surrounding science, nephrology, and healthcare research. And since has been since 2012, and more recent statistics on the blog inform there have been over 19,500 views in since 2012. There is a YouTube page which is a collaborative page, or two YouTube channels, or two YouTube pages. One YouTube channel has one YouTube page has 70 educational videos, and one channel has 54 in around 54 audios and podcasts since 2019. And then there's also a SoundCloud page, one SoundCloud page which has 50 tracks representing kidney care for pediatrics and young people, and adult renal and the adult renal population since 2021. The RPSG, both RPSG and KDAR, in regards to some of the projects. Now, the publication from 2014 sort of highlights, or at least informs, some of the initial projects that had taken place primarily through the RPSG. However, listeners and viewers, as part of this presentation, or this overview, to inform that that uh, that those that it's that to find out more. To find out more, it's to would be to it'd be good to refer to the web page, the RPSG web page, which sort of represents KDARS as well. KDARS also at the same time do have a collaboration, or a sort of a partnership with the National Kidney Federation, which has been a partnership with the National Kidney Federation, NKF, in the United Kingdom. However, the RPSG page, the RPSG website, is there to get a feel for the force of work that has been going on between both social media platforms, the RPSG and KDARS, for over 2 decades. And now I just look at sort of implications for practice. So educating healthcare professionals about the use of social media and the importance of the patient role, and how to interact with patients, is still another important area of research. Evidence indicates at the same time that healthcare professionals using or utilizing a professional or expert language or technical jargon without patient having knowledge in the first instance will continue to act as a barrier to communicate. So targeting the attitudes of providers through social media solutions is important, so that the repertoire between healthcare service users and service providers becomes more multidisciplinary and mainstream. So in as part of this sort of presentation overview, a look at a discussion. So over the past 2 decades, patients have been sharing experience and understandings between these two online platforms to help inform smarter care and decision making. Patients are using online support groups and such platforms as space wherein they otherwise have limited support and communication. One question, one question that has propped up includes should at least has popped up as part of sort of evidence-based works that includes should health professionals provide support only if context is clinically relevant? And so, because patients are not traditionally taught to communicate clinically relevant, clinically relevant context, it could be postulated that most shared experience through social media platforms is all important and relevant. Patients, for example, patients or healthcare service users have own ways of sharing and communicating health complexities. So this snapshot overview highlights there is a need for broader healthcare professional involvement in addition to peer support. The RPSG and KDOS have developed several collaborative publications, including one that investigates educational gaps between online pediatric and adult kidney cohorts close to 2 decades. So an overall sort of conclusion as part of this presentation, then listeners and viewers, listeners and viewers. So co-developing e-learning and educational modules involving patients and professionals in case scenarios would prompt more joined-up care in addressing world healthcare inefficiency. Commissioning involving patient and professionals is required globally. That ends this research and presentation sort of overview, a research and presentation overview, and as part of this works looking at the renal patient support group, the RPSG, and the kidney disease and renal support group, KDOS group for kids. And this has been a research and presentation as part of a ZtormLabostix collaborative and a ZtormLabostix production. Thank you.